Hi there, welcome back to our channel. Today let's take a closer look at the stages of osteonecrosis and what they mean for those who have been diagnosed with this condition. The stages of osteonecrosis typically range from early to late stages and are classified based on the extent of bone damage. Let's take a closer look at each stage. Osteonecrosis Stage 1. Stage 1 osteonecrosis typically involves no visible changes on X-rays, but an MRI may detect a small area of bone damage. At this stage, the condition may not cause any symptoms, and it's possible that the condition can resolve on its own without any treatment. However, it's important to monitor the affected area closely to prevent the condition from progressing. Some lifestyle changes, such as avoiding high-impact activities, may be recommended to reduce the risk of further damage to the affected bone. If you have been diagnosed with Stage 1 osteonecrosis, your doctor may recommend regular monitoring to track any changes in the affected bone. In some cases, medication or other treatments may be recommended to slow or halt the progression of the condition. It's important to keep in mind that osteonecrosis can progress rapidly, so early diagnosis and treatment are critical to preventing further damage to the bone and joint. If you are experiencing any symptoms of osteonecrosis, such as pain or stiffness in the affected area, it's important to seek medical attention promptly. With the right treatment, it is possible to manage the symptoms of osteonecrosis and prevent further damage to the affected bone. Please like and subscribe to our channel and click bell icon to get more health updates. Osteonecrosis Stage 2. Stage 2 osteonecrosis is characterized by the beginning of bone collapse, which can cause pain, stiffness, and difficulty with movement. The exact cause of osteonecrosis is not always clear, but certain risk factors can contribute to its development. Treatment options for Stage 2 osteonecrosis depend on the severity of the condition and the specific joint affected. The goals of treatment are to relieve pain, improve joint function, and prevent further bone collapse. Treatment options may include medications, physical therapy, electrical stimulation, core decompression, or joint replacement surgery. It is important to seek medical attention as soon as possible for osteonecrosis, as early intervention and treatment can help prevent further damage and improve outcomes. Working closely with a healthcare professional who specializes in the treatment of osteonecrosis can help determine the most appropriate course of treatment for individual situations. Osteonecrosis Stage 3. In Stage 3 osteonecrosis, the affected bone shows evidence of collapse, but the joint is not yet severely damaged. Stage 3 osteonecrosis can cause pain and limited mobility in the affected joint, and can lead to further damage if left untreated. The condition most commonly affects the hip joint, but can also occur in the knee, shoulder, ankle, or other joints. The treatment options for Stage 3 osteonecrosis depend on the location and size of the affected bone, as well as the patient's age, overall health, and activity level. Treatment may include medication to reduce pain and inflammation, physical therapy to maintain mobility and strength, and lifestyle changes to reduce stress on the affected joint. In some cases, surgery may be necessary to preserve the joint and prevent further damage. Core decompression is a surgical procedure that involves drilling into the affected bone to create channels for new blood vessels to grow. Bone grafting may also be used to help stimulate new bone growth. It is important to work closely with a healthcare professional to determine the best course of treatment for Stage 3 osteonecrosis. Early intervention can help prevent further damage and improve the chances of a successful outcome. Osteonecrosis Stage 4. In Stage 4 osteonecrosis, the affected bone has collapsed or is in the process of collapsing. This can lead to severe pain, limited mobility, and loss of function in the affected joint. Stage 4 osteonecrosis is the most severe form of the condition and can be caused by a variety of factors, including trauma, steroid use, alcohol abuse, and certain medical conditions such as sickle cell disease. The condition most commonly affects the hip joint, but can also occur in the knee, shoulder, ankle, or other joints. The treatment options for Stage 4 osteonecrosis depend on the location and size of the affected bone, as well as the patient's age, overall health, and activity level. In some cases, joint replacement surgery may be necessary to restore function and reduce pain. This involves replacing the damaged joint with an artificial joint made of metal and plastic. Other treatments may include medication to reduce pain and inflammation, physical therapy to maintain mobility and strength, and lifestyle changes to reduce stress on the affected joint. It is important to work closely with a healthcare professional to determine the best course of treatment for stage 4 osteonecrosis. Without treatment, the condition can worsen and lead to further joint damage and disability. In conclusion, the condition progresses through 4 stages, with stage 1 being the mildest and stage 4 being the most severe. Stage 1 osteonecrosis shows no evidence of bone collapse and may not cause symptoms. Stage 2 osteonecrosis may show evidence of bone changes on imaging studies and may cause mild to moderate pain or discomfort. Stage 3 osteonecrosis shows evidence of bone collapse, but the joint is not yet severely damaged. While stage 4 osteonecrosis is characterized by severe joint damage and collapse. Treatment options for osteonecrosis depend on the stage of the condition and may include medication, physical therapy, lifestyle changes, and surgery. It is important to work closely with a healthcare professional to determine the best course of treatment for each individual case. Early intervention can help prevent further damage and improve outcomes. Thanks for watching. We hope you found this video helpful. If you did, please give it a thumbs up and subscribe to our channel for more videos like this.